The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Well, we're here again, Saturday morning. We're such happiness here when you walk in. Good morning. Well,
this is my therapy.
This is my therapy, too, when you come in. I love this. Well, it's because it's a chance for you just to really talk about something that you really have been concerned about. And what is it this morning?
This morning, I saw a few of my patients that I've been managing for peripheral neuropathy. And peripheral neuropathy, just in general, those individuals, not only they suffer a lot, and it's a peripheral neuropathy usually can start in the early 40, mid 40. Sorry, but the patient do not become aware of it in the mid 50. So a lot of the statistics and the data out there in research had been on the baby boomers. But young adults can suffer from peripheral neuropathy, especially those that have diabetes at a young age, because they have already some form of nerve damage. But when we talk about neuropathy, and for the pencil talk audience, is neuropathy, neuropathy. Neuro means nerve, and pathy mean damage or disease. So it's a disease of the nerves. And we have spoken already about damaged nerve. In the past, we spoke about Parkinson's disease. We spoke about Alzheimer's disease. Those are damaged nerves, but those are central neuropathy. That means that the damage is in the central nervous system, the brain, and the spinal cord. So anything that influence or affect the brain and the spinal cord will be a central neuropathy, and any nerve outside the brain and the spinal cord will be called a peripheral neuropathy. So that the audience get clear that we are now talking outside the nerve and the spinal cord. And this is important because the nerves, once it leave the spinal cord, it needs nutrients. And the nutrients come in through blood vessel. And once those nutrients get utilized, and there are waste material to be get rid of, those go through the vein. So in a person that are intact, that they have not have an amputation or no type of veins or artery surgery, because sometimes when you have heart disease, they take the vein from the leg to put it around your heart to replace the one that is diseased or damaged. So we're talking about a person that have not had any type of surgery, they have not been touched by a knife, and they can have still peripheral neuropathy. And the question is, why? Why? If nobody ever cut me, why my nerve had been damaged? And there are several causes of that. And one of the most common one that we know of is diabetes. And I was talking to one of my patients yesterday, who is a doctor, a PhD, a psychologist. I was talking to one of my patients yesterday who is a diabetic, and is not that concerned about the sugar being uncontrolled. So I was just saying, well, if you look at the blood vessel is surrounded by muscle. That's how the blood vessel can dilate and contract depending on where the blood need to go. If the blood need to go far, we need a little bit of pressure to push the blood through. So going back to the nerve, remember at the beginning I said, the moment the nerve leave the spinal cord, it need to be supplied by nutrients and the waste material need to be get rid of, and the nutrients are brought in by those tiny, 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 tiny blood vessels. When you have diabetes and the muscle around that blood vessel become too big because of the excess amount of sugar, the blood vessels start collapsing on you. So there are no nutrients. And the nerves start suffering.
That's a very good explanation.
Yeah.
That's what I like about you so much. You really do this so well. So because the blood vessels are collapsing, no nutrients are getting in, and it literally dies, doesn't
They
it?
basically can die. The unfortunate part is that they just linger in there and they just suffer. And the more damage you produce, because imagine a blood vessel, let's say 3 feet long, and if from this point on my right hand is 0.0, let's go half an inch, and there is a collapse there. So that portion of the nerve, a half an inch, is going to start suffering. And then go another 1 inch, and there's another collapse there. Then there's suffering there. And you keep going, and that blood vessel, as you're expanding toward your big toes, is collapsing at different level.
So that's why you're not feeling anything.
That's why you can, well, not only you cannot feel, which is one of the worst form of neuropathy that we see, not only you cannot feel, you can feel tingling, and you feel like you're crazy because you feel this ant crawling on you as you are walking, talking, having dinner with a friend. When you go to bed, you feel like ants all over your body.
So why are you feeling that?
Because the nerves are sending the wrong signal to the brain. The brain is receiving the wrong signals.
Wow.
Have you ever sat in a chair for a long time and your, what we call in quotation, your leg have fallen asleep?
Yes.
That's a neuropathy. It's produced by pressure on a blood vessel that is supposed to be supplying a major nerve that go down your leg. So you have just produced yourself a little sciatica. So when you close that blood vessel for a while and your legs quote unquote fall asleep, I mean that happened to me too. It happened to all of us. How does your leg feel? It feel like it's big.
Yes.
It feel numb.
Yes.
You try to step on the floor. It's painful like crazy.
Yes.
So you have to stop, right? That's a neuropathy. All of us have suffered a form of neuropathy, but imagine living with this for the rest of your life.
Terrible.
It's horrible.
Terrible.
And, you go to the doctor and you say, my leg is swollen. And you look at the leg and say, it's not swollen. It is swollen, doctor. I'm telling you, my leg is swollen because they feel like just like when you go to the dentist and they give you anesthesia, your lips feel big.
Yes.
And you go and look at yourself in the mirror. Is my lip big? No, it's the same. It's just the sensation because of the fact that we have blocked the nerve. You are receiving the wrong signal to the brain. As soon as the anesthesia wear off, in case of sitting for a prolonged period of time without switching position, the moment you get up and you allow circulation to take place, it goes away.
That's the first time I've ever heard it described like that, but that is very possible. Now, the one thing that I have heard, even young people who have gone through cancer treatments, they've gone through the, whether it's radiation or the chemotherapy, they all wind up with neuropathy. Will you explain that?
Well, yes, because remember with cancer therapy, just like with aggressive antibiotic, any chemical that you are putting into the body for goods or for whatever reason you're doing it, alcohol, it's another chemical you put in your body. Any chemical you put in your body in excess for a prolonged period of time can produce peripheral neuropathy because the toxin. Because now instead of affecting the blood vessel, now you are directly traumatizing the nerves. So the toxins that are coming in, we see that in a rare condition, a rare paralysis called Guillain-Barré syndrome. So the toxin coming in will produce a damage to the nerve directly. And those are worse than the diabetic one. The diabetic one, we can work with the sugar and help them out. But the toxin, you see that also in patients with chronic kidney disease. If you read my book on chronic kidney, on preventive renal damage, one of the main things is that the kidney is supposed to be cleansing your body from all the waste material. So once you lose kidney function, you're going to retain some of that waste material in your body. And that waste material is going to go through the artery now instead of through the vein and go back to the tissues like the nerve and the muscle and produce damage.
And are
That's
you
why
able
it's so
to help
important
people?
to keep your kidney.
Yeah. Oh, right. And I guess the really bottom line, so people at home are shaking their heads and saying, all right, Dr. Mencia, and I'm going to give you his phone number.
How do I find you?
Right. I'm going to give you your phone number, then I want to know if you can help them. So the phone number to call for an appointment, and I know a lot of people have peripheral neuropathy out there, 954-489-1345. That's 954-489-1345. Get your pencils, get your paper, just not any piece of paper. Get a little book. Call it the Dr. Mencia book, because you're going to get a lot of information from him over the many months that we're doing this. It's called the Adult and Geriatric Medical Center. They're located on East Commercial Boulevard. No matter where you live, it's worth going there. 954-489-1345. So, can people get any relief from this?
Yes, and if you go to a doctor, and I'm so blessed, I just have Dr. Steve Coleman. Nice guy. You're going to meet him. I'm going to bring him to the show one day.
Good.
He's a charm. Steve Coleman, he, like me, believe in traditional and holistic medicine. So, and he went to one of my lectures, and we sat down. We just got along from the get-go the moment we met. He coming from Chicago.
Listen, wait a minute. Who do you not get along with from the get-go? So that's not anything special. Go ahead.
The people that tell me, I don't believe anything on holistic medicine. I only believe on traditional. Those people I don't get along with.
Okay. We don't know any of those.
So Steve Coleman, we met, and we said, we have to join forces. We're both doing the same thing. And I said, be happy to have you as part of the team. So he just joined me, and he's on staff, and he does a lot of the hormone replacement therapy, and he does treat peripheral neuropathy also. So I'm very blessed, and we'll bring him to the show to talk about hormone replacement therapy, because that's his niche. He really, really loved that. So before we talk about the treatment, and I tell you what I do and what people are doing out there, the way that before you even come to see me, if you cannot come and see me and you want to go and see your primary care doctor, the way that that you have peripheral neuropathy, if you have a persistent numbness, you have tingling in your lower extremity or your arms, and sort of unusual sensations, like when you have anesthesia from the dentist and those kind of things. It can be painful also. And the pain is more abrupt while sleeping, while the person is sleeping. And there can be also burning sensation. There can be burning sensation on the extremity. Now, let's talk about treatment, because if you go to a traditional medicine doctor, traditional medicine will give you traditional drug. And we have one of the most deadliest drug out there is gabapentin.
How do you spell that?
Okay.
I mean, because I can't even. I have not heard of that.
Yeah, gabapentin is G as in golf, A, B as in boy, A, P-E-N, T-I-N, gabapentin.
And people take that as a drug for neuropathy.
As a drug to help. I have not seen patients that have come to me and say, the gabapentin really cure my neuropathy. I don't feel anything anymore. It makes the symptom better. Because it works like this anti-seizure medication. So what it's doing to the nerve is trying to bring the harmony in the transmitters, those chemicals we spoke about last week in Parkinson, bringing harmony in those transmitters so that the pain, the area of the brain that is the perceiving part, sort of calm down. So gabapentin, there's also other medications that are cleaner, such as Lyrica. When the patient has a lot of pain, they use something called Cymbalta.
Yes, now that we see advertised.
Cymbalta is Cymbalta. Now the thing with Cymbalta is that it's heavily metabolized through your liver. So if you're going to take Cymbalta and only Cymbalta, amen, do it.
No, I really don't.
But if you're going to take Cymbalta and you are taking other medication, I tell my patient, let's be careful here.
That's right.
So usually,
not happy.
You have to look at the entire body. I cannot look at 2 feet coming in pain. I have to look at the whole human being with 2 feet, with their feet in pain.
No, I agree with you. I'm so happy that you look at it this way. So
let's go with homeopathic.
Right. Please. I like
let's
homeopathic.
Go with homeopathic.
Really.
There's a doctor. He's a PhD. He's not an MD. Dr. David Phillips. One day, maybe if we contact him, we'll bring him to the show. David Phillips. And David Phillips is very much into traditional, homeopathic, non-traditional approach. And this guy, he invented he took his kids, he has 4 kids, and he took his kids to the pediatrician, and then they were using the mercury thermometer.
Yeah.
And he said, that's no good. And he invented the ear thermometer.
Really?
Yes,
I've seen that, and I can't understand how they can do that.
And then one of his kids developed a wart, and he didn't like the way it was being treated, so he developed a little pen to treat warts. And his father started suffering from neuropathy, and of course he went to a traditional doctor and started being treated with gabapentin and all this. By then they used to use also a lot of antidepressant, because you must be cuckoo, so antidepressant. So the dirtiest antidepressant out there are called tricyclic, like Elavir, nortriptyline. Those are one of the dirtiest things that still can be used in certain conditions, but it should be like the last resource out there. There's so many antidepressants that are cleaner that we can use, like Vibrate and other things. So anyway, when his father was getting all this drug, he was getting more side effects from the drug than benefit. So he invented a machine called the Rebirth.
This is amazing. What a story.
So he invented the Rebirth machine. And the Rebirth, what it does, it analyzes, it sends a signal to the nerve. This guy is amazing. Would love to meet him one day. He invented a machine that will send a signal, let's say, to the right leg. It will travel to the spinal cord. It will transmit the signal to the left leg, and then bring it back to the spinal cord and bring it back to the right leg, and the machine will analyze, and then we'll look what part of the nerve is damaged. Because when we do nerve study, I'm going to make a doctor out of you. I'm going to have to give
I love this. I wish you were on for years.
I'm going to have to give you a doctor degree.
Yeah,
so
please.
This is how a signal from a nerve will look like. And this ascending part tell us about how the patient is perceiving the signal. The top part of this graph is telling us how well the signal is going to the brain. So if the is the signal being transmitted to the brain or not. And this descending part tell us about pain. Is the person perceiving too much or no pain at all? And then this deep down here, this little descending part that we have down here, is when the nerves try to reset itself for the next signal. And this happens in milliseconds. Okay, so what the machine will do will analyze a graph like this, and if the person is not perceiving the signal, then it start sending signal to counteract, so everything becomes normal again. So it's really regenerate that nerve. And just yesterday, and that's how I prepared the topic last night, because just yesterday I saw two of my patients that I have prescribed a rebuild machine for them. And they say, it has worked for me so well that I put it away. And I say, no, don't put it away. I want you to continue to use it, because the objective here is for you not to have to take medication. Now, what Dr. Coleman and myself would do is when the patient, because the machine by itself is great, but in my opinion, and not to force people to come and see us, but in my opinion, the machine without the vitamins that we utilize is not sufficient. So I use a cocktail of vitamin B1, I use B12, the alpha-lipoic acid, which is a transporter. And there are different type of alpha-lipoic acid, but there is one that is very specific for the nerves that we utilize. And when my patient take that cocktail with the machine, unless they have one of those HMO that will not allow them to have anything.
No, but I was thinking about the cocktail when you said about the cocktail. I understand.
The cocktail with, the machine, it have worked amazing. Now, let me be a doctor, just, being your doctor. If you have peripheral neuropathy and you put I have two kids, 12 and 14, right? And they play around. They have all these toys on the ground. And sometimes they take coins, and I put on my shoes, and I see that when they are playing, there are coins inside my shoes or a pebble or something inside my shoes. So I just take it out and put my shoes on and what have you. When you have peripheral neuropathy and there is a coin in your shoe, you won't feel it. You're going to put your shoes on with the coin there. By the time you take off your shoes at the end of the day or when you come back from your doctor, you're going to have a hole on your foot, at the sole of your foot.
Pretty serious.
And it's going to be a deep hole that will basically penetrate to the bone. A lot of people have amputation because of the complication of peripheral neuropathy.
Amazing.
Because once you get that little hole, you don't even know you have it. Then you take off your shoe, you put on your sandal, you start walking around. And only when somebody look at your shoes, at your feet to cut your nail is when they say, oh my God, you have a huge hole at the bottom of your feet. And when you go to the doctor, usually it's too late. It have invaded the bone, and now you have osteomyelitis, infection of the bone, which is very hard to treat. And if it have penetrated into the blood vessel, then it's a systemic problem that will require amputation.
Whoa. Okay, I have to stop you a minute. So if someone comes in, they don't even know they have any peripheral neuropathy. In your examination, are you able to see that?
Absolutely.
How?
In a 10-minute. Well, basically, we check sensation. And it's very easy. You can do it at home yourself. You can have your significant other take a pencil and touch different parts of your body, and you close your eyes and make sure you put a pillow in front of your face so you don't see what they are doing. You have to be really blind to this. And if they started putting the pencil around you, and let's say I put it by the outside of your right ankle, and I ask you, where's the pen? And you say, it's on my big toe. And you don't say anything, you just go to another spot. And if you see that the person is getting a lot of these things wrong, they already have severe neuropathy. Now, you want an expert to examine you, because I don't want you to be diagnosed with severe neuropathy. I like preventive medicine. I want to pick you up early in the game, especially if you know that you have kidney damage, if you know you have diabetes, if you know that you have taken multiple antibiotics that can damage your liver and can produce toxin that can damage your nerve. We forgot to say, hereditary. Neuropathy can be hereditary.
Really?
So if you have a close family member that have neuropathy, then you yourself also should be checked for for neuropathy.
So this is very exciting stuff because
very common too.
Very common. Let me give you a phone number, everyone. This is very important. You don't want to have a stone in your shoe and not be able to feel it and wind up with something that's so serious where it even could be amputation eventually. So let's do this. Let's do some prevention. And of course, you're hearing Dr. Dr. Mencia.
If
really,
they have Lyme disease also. If they have Lyme disease, those people are very prone to peripheral neuropathy.
Lyme disease.
Yeah, because Lyme disease love nerves.
Nerves.
Yeah, so it goes and attack the nerves. So Lyme disease, people with the history of Lyme disease also should be on the lookout for this condition.
You always make me take these deep breaths when you come here.
So
the phone number. Yeah, please. Yeah, let me give him a number. 954-489-1345. 954-489-1345. The Adult and Geriatric Medical Center, and this is, of course, Dr. Andy Mencia, who charmed everyone at the Boomer Expo. I'm still hearing about that. And he really, he's a very wonderful physician. And you're listening to the Wonderful World of Wellness. And I have to tell you this, too. Most of you should know Medicare and most insurances are accepted there. And they also, as Dr. Mencia was saying, he kind of gets all these people to join him at his wonderful practice because they all have this affinity for helping people, and they do like to do both, the traditional and the what we call anti-aging, I guess. Mm-hmm. Dentist, ophthalmology, neurology, cardiology, if you want to lose weight, psychology. Of course, Dr. Mencia is a geriatric physician.
I always have surprises for you, right?
Oh, my heavens, yeah, always. Dermatology.
I have another surprise.
Oh, I think I'm going to faint. This is getting, okay. What's my other surprise?
Nutritionist. Nicole Andrews.
Very, very important.
Excellent person is going to be working with us. We're going to have a nutritionist as of Monday this week. So the center is really becoming a preventive, multi-specialty, all-in-one, under-one-roof type of care. My dream is coming true. Don't wake me up. Don't wake me up.
So Dr. Mencia,
we have to say goodbye.
We have to say goodbye. We thank you so much for being here. We really appreciate it, and we will come back to you. So thank you.
You're welcome.